Breast cancer is a disease that primarily affects millions of women around the world. However, when diagnosed early, the chances of treatment and recovery increase significantly. This video is dedicated to raising awareness about the early signs of breast cancer, providing vital information that can help save lives. We will cover the early signs that every woman should be aware of. It's crucial to remember that many of the signs we will discuss are not necessarily indicative of cancer, but are important reasons to seek medical evaluation. Before we dive into the details, remember to subscribe to our channel and turn on notifications to stay updated with our latest content. Breast cancer is a type of cancer that forms in the breast tissue, usually in the glands or ducts that produce milk. This type of cancer is predominant among women, but it can also affect men, although it is much less common in them. The disease is characterized by the uncontrolled growth of abnormal cells that cluster together to form a tumor. These tumors can be benign, which are not dangerous and do not spread, or malignant, which are the true cancers capable of invading nearby tissues and forming metastases, that is, spreading to other parts of the body. Early diagnosis is crucial, as treatment options and chances of recovery significantly improve when cancer is detected in its early stages. And now, let's look at what these early stages entail. Number 1. The appearance of a lump in the breast or underarm area. The first early sign of breast cancer that warrants attention is the presence of a lump or mass in the breast. This is often the most common and noticeable sign of the disease. Lumps can vary in size, shape, and texture, and are often discovered by chance during a self-exam or routine screening. Lumps associated with breast cancer tend to be hard and have irregular edges. They are usually painless, which can cause them to go unnoticed without regular exams. Unlike many benign lumps, which move easily under the skin when touched, cancerous lumps may feel more fixed and do not move easily within the breast tissue. Although they can occur anywhere in the breast, many are found in the upper outer part of the breast, near the armpits, where the breast tissue is denser. Detecting a lump does not necessarily mean it is cancer, but it is crucial that any new mass or change in breast tissue be evaluated by a healthcare professional. Number 2. Changes in the skin of the breast. The second early sign of breast cancer that requires vigilance is any change in the texture or appearance of the breast skin. This can include symptoms such as puckering, redness, or even a peau d'orange appearance, where the skin becomes dimpled and resembles the surface of an orange. Changes in the skin that cause it to appear puckered or dimpled can be a sign that something abnormal is occurring beneath the surface. These changes can be caused by the growth of a tumor that alters the skin's structure. The presence of redness and a warm sensation in the breast skin can be indicative of inflammation or infectious processes, but they can also be associated with cancer. In cases of inflammatory breast cancer, these symptoms are more pronounced. This specific texture can be caused by the blockage of lymphatic channels, resulting in edema and thickening of the skin. It is an important clinical sign and is often associated with more advanced forms of breast cancer. Number 3. Changes in the nipple. Changes in the appearance, position, or function of the nipple can indicate underlying issues, including the presence of breast cancer. A nipple that retracts inward instead of pointing outward can be a concerning sign. This change can be caused by alterations in the internal structure of the breast due to tumor growth. Any significant change in the position or shape of the nipple can indicate alterations in the underlying breast tissues. The presence of scaling, rash around the nipple, or changes in skin texture may be signs of Paget's disease, which is a rare type of breast cancer. Number 4. Nipple discharge. The fourth early sign of breast cancer to monitor is the presence of nipple discharge. This discharge can vary in color and consistency and can occur without any nipple stimulation. The discharge may be clear, milky, or even bloody. Discharges that are clear or bloody are particularly concerning and require immediate medical attention. When discharge occurs in only one breast, it is especially important to investigate, as bilateral discharge, in both breasts, is often related to normal hormonal changes. Discharge that occurs without manipulation or pressure on the nipple can be a warning sign that something abnormal is happening. Number 5. Rash or scaling on the nipple. These symptoms may indicate benign conditions, but can also be signs of more serious diseases, such as Paget's disease of the nipple, which is directly related to breast cancer. The skin around the nipple can show rashes or appear scaly and irritated. The skin may be red and inflamed or have a thickened texture. These skin changes may be accompanied by itching or pain. In more severe cases, there might be sensitivity to touch or a burning sensation. Unlike common irritations that might resolve with basic care, changes caused by more serious conditions persist or worsen over time. Number 6. Persistent pain in a specific area of the breast. This sign is particularly important, as breast pain is often not associated with cancer. However, pain that is constant and concentrated in a single area may indicate something more serious. Cancer-related pain is usually localized to a specific part of the breast, rather than being diffuse across the entire breast area. It tends to be continuous and does not diminish with changes in position or after the menstrual period. The pain can be described as a burning sensation or as internal pressure, different from the cyclical pains associated with the menstrual cycle, which are more generalized and often hormonal. In many cases of pain associated with breast cancer, there are no visible changes in the skin or shape of the breast, which can make detection difficult without the aid of imaging tests. Number 7. Increase in size or change in the contour of the breast. The 7th and last early sign of breast cancer to watch for is an increase in size or a change in the contour of the breast. These changes may be subtle initially, but are important indicators that can suggest the presence of a tumor or other medical conditions associated with breast tissue. One breast may start to appear significantly larger or shaped differently compared to the other. While it's common to have a slight size difference between breasts, a noticeable change can be a warning sign. Changes in the contour, such as bulges or indentations on the surface of the breast, can be observed. These may be caused by the growth of a tumor that distorts the normal architecture of the breast tissue. The affected area may feel heavier or denser to the touch. How to perform a breast self-exam. Performing a breast self-exam regularly is an important practice to monitor any changes in the breasts. Here is a step-by-step guide on how to conduct an effective breast self-exam. Step 1. Stand in front of a mirror with your shoulders straight and your arms on your hips. Carefully observe your breasts, first with your arms lowered and then raised. Pay attention to changes in size, shape, contour, or any redness, swelling, or alterations in the skin or nipples. Step 2. With your arms raised, continue to observe your breasts in the mirror. Look for any discharge of fluid that may come out of one or both nipples. This can include a watery, milky, or bloody fluid. Place your hands on your hips and press firmly to flex your chest muscles. Observe if there are any changes in the shape or contour of the breasts. Step 3. Raise your right arm and use your left hand to carefully examine your right breast. Use the flat part of your fingers to feel the breast with gentle movements. Make small circular motions, using different levels of pressure to feel all parts of the breast, from top to bottom and from side to side, from the collarbone to the lower part of the abdomen, and from the armpit to the cleavage. Remember, early detection saves lives. Do not hesitate to consult a doctor if you notice any of these signs. Stay vigilant and take care of your health. Performing breast self-exams regularly can help you become familiar with the normal appearance and feel of your breasts, allowing you to detect any unusual changes earlier. If you found this video informative, please give it a like and share it with friends and family. Your participation is essential in spreading knowledge and awareness about breast cancer. Leave your comment below with any questions or suggestions for upcoming videos. See you next time.